that are potential, like pipeline programs, curricula, and then conference type things. And you guys can talk about each of those things.
Okay, it's time for me to let everyone in, so.
All right, I think we're going to duplicate each other because I thought you were just talking about clerkships.
Okay,
but
I'll just talk about clerkship then.
Okay.
Hi, everybody. Is everyone seeing the PowerPoint slides clearly? Okay, perfect. So since it's just hitting 2:01, we're gonna get started. So good afternoon, everybody. Thank you so much for coming to our didactic this afternoon, where we'll be talking about resident-driven recruitment and match of underrepresented minority medical students. This idea really came about after having a conversation with my colleagues and realizing that there are just so many different and great things being done at different institutions for recruitment of medical students. So what better way to discuss some of the best practices than during an SAEM didactic? So without further ado, I would love for our amazing panelists to introduce themselves, starting with Dr. Ryan Tsuchida.
Hi, everyone. My name is Ryan Tsuchida, and I'm one of the chief residents of the University of Michigan.
Hi, everyone. I'm Jessica Faiz. I'm one of the chief residents at Boston Medical Center.
Hi, everyone. My name is Jeff Sakamoto. I'm one of the chief residents at Stanford.
Good afternoon, everyone. My name is Kevin Smith. I'm a second-year resident at Advocate Christ in Chicago and a member of the LGBT community.
Hi, everyone. My name is Tanrayo. I'm one of the chief residents at Yale New Haven Hospital in Connecticut.
Hi, everyone. My name is Arthur Pope, and I am one of the chief residents at the University of Chicago.
Hi, good afternoon, everyone. I am Jeremy Collado, and I'm one of the chief residents at Denver Health.
And hi, everybody. I'm Dr. Wendy Sun. I'm one of the PGY2s at Yale New Haven Health.
Excuse me, Wendy, before you get started, I just want to remind all the participants to please keep your mics on mute unless you're asking a question. Also, it's nice if you want to turn on your camera so we can see you. You also don't have to do that if you want to remain anonymous in the background. But we're all here, and my name is Bill Toon. I'm just the staff person helping out with this room here, but I'm going to turn it over back to Dr. Sun.
Awesome. Thank you so much, Dr. Toon. And again, thank you to everyone who's joining us today. So now we're going to get to the fun part of our didactic, where we're going to have a conversation beginning with a discussion about the utility and steps in starting a diversity inclusion committee. And then we'll be discussing recruitment of underrepresented minority medical students in the pre, during, and post-interview season with an emphasis on support and retention. During this panel discussion, we would love to hear our audience's thoughts and comments in the chat function. And there will be time for question and answer at the end. So please, as the didactic is going along, come up with questions that you may have for any of our panelists. And so to begin, Dr. Jessica, why don't you start us by discussing what a resident-led diversity and inclusion committee means?
Yeah, thanks, Wendy. So in order to do this very challenging work, we can't do it alone, which brings us to the formation of a dedicated committee for this purpose. We want to emphasize that a diversity and inclusion committee is nothing by name. It requires people who are invested in the work and are recognized and or compensated for their time. As we know, the majority of people doing this work are underrepresented themselves, which is what is commonly referred to as the minority tax. Establishing a D&I committee allows for formal leadership positions, creates a ladder for promotion, and allows for strategic initiatives toward a common goal. So probably why a lot of you are here, how do you start one? At my institution at Boston Medical Center, it began with a small cohort of passionate residents and has grown through the use of resources like this talk here to learn about best practices. Lastly, it requires engaging stakeholders. So that's your program director, your department chair, your medical education office, and all of these things combined in order to realize change.
It's super important, Jessica, that you bring up stakeholders, because, there are folks that really make an impact. And I think, by bringing up stakeholders, it brings up the question of funding. So Tereo, do you mind just kind of, telling us about your experiences asking for funding when the Diversity Inclusion Committee was starting up at Yale?
Sure, definitely. I'll be happy to speak on that. So I'm going to talk about a broad framework, and then at each point, I'll kind of tell you what we did at our own institution. So I guess the first question is, why do you need a budget for your diversity committee? Money's always good, right? But on a serious note, let's just talk about some evidence-based medicine. So there was a paper published in 2016 out of Denver Health, which showed the effects of 3 main interventions on URM interviewees and URM residents being recruited into the residency. Out of those 3 interventions, 2 of them had to do with funding. One was a scholarship-based externship program, and the second one was a fully funded second look event. And so after implementation of these interventions, they saw a doubling in the number of URM applicants that were interviewed by their program, and a 3-fold increase in the number of URM residents that were enrolled into the residency program. And so I think that speaks volumes to the importance of funding for your diversity and inclusion committee. And so kind of just to go through some logistics. So the first question you want to answer is, who am I asking for funding? Jess kind of touched on this a little bit, but you really want to figure out the structure of the finances of your institution. Is the funding going to be coming from a graduate medical education level, or from the chair of the emergency department, or your emergency medicine residency leadership specifically? And so once you're able to figure this out, you kind of know who you're going to ask for funding. In our case, it was a joint funding from the chair of the emergency department as well as the emergency medicine residency leadership. And so now you know who you're going to ask for money. And the next question is, when am I going to ask for money? This is something to be very cognizant of, because every institution has sort of a financial calendar, which sometimes differs from the calendar of the academic year. So we really want to know what those deadlines are so you can get your request in as soon as possible. Next logistical question is, how am I going to ask for funding, which is also very important. The most important thing here is to be intentional about asking. This is not something you just do in the hallway like, hey, we need money for our committee. I think kind of the way we approached it is actually scheduling a meeting with whoever you're going to be asking for money from, and have a presentation, be prepared, have some evidence-based medicine stuff that you can throw in there, sort of like the Denver paper that we just talked about. And you go ahead and give your best pitch and hopefully they say yes. In terms of what the budget looks like, which I think is another important logistic, kind of depends on your goal as an institution and what your goal is. Are you focusing on recruitment? Are you focusing on retention? So basically you make an itemized list, is kind of what we did, and figure out what the costs of those things are in your specific location. So those are the logistics, the who, the when, the how, the what. The last thing I just want to touch on with regards to funding is it's good to be accountable. So basically keep a spreadsheet of how you're spending your money over the year for multiple reasons. But one, it's a good tool of reference for the committee moving forward in order to determine how to allocate resources moving forward. But also 2, when you do go to pitch your budget for the next academic year, you have substantial data to show them and how you use the money. All that being said, let's say you do all this stuff and your budget is declined. It's not the end of the world. There are other ways to get money, such as through fundraisers, which I won't be speaking about right now. And if the first time you don't succeed, sort of evaluate, improve, and then try again.
Thanks so much, Tereo. I think, you definitely bring up a lot of very important points. One of them is allocating resources, telling, exactly stating out where this funding will go. And I think that's a perfect segue to kind of the pre-interview section now of the discussion. Jeremy, do you want to kind of tell us about what you guys do at your residency of the funding that goes in the pre-interview session?
Yeah, thanks so much, Wendy. And I'm very glad that Tereo brought up that paper, because it kind of explains what we do here. So using that funding, partially from the mostly from the department, but also from the program itself, we're able to bring in about 10 URM rotators each year. that come in and do a specific clerkship with us. So in addition to doing the normal shifts that they would in the department, we actually have them work with one of our pipeline programs, specifically with high school students, so that they're more engaged in our community. So not only are they seeing our community in the emergency department itself, but they're also seeing the community outside of the department and seeing what they're doing, I guess, in the real world and what our patients are actually experiencing. So it's getting them involved as early as possible. And it's interesting because when you look across different programs, whether it be emergency medicine or otherwise, a lot of the people from URM backgrounds are very interested in working with the community. So if you don't have that as part of your program in and of itself, you're probably not going to recruit the applicants that you want. So being very understanding of who you're recruiting and really what the community that you're working with is. And I think that's really important looking forward.
Thanks, Jeremy. Tereo, do you want to discuss kind of what Yale does during the pre-interview season?
Yes, definitely. One thing that we do during the pre-interview season is we do make trips to residency fairs at historically Black medical schools. So for example, Howard University and Meharry Medical College, just to mention a few. So these are intentional visits, fully funded and fully organized by multiple different parts of our institution. So the Graduate Medical Education, the Office of the Diversity and Inclusion Officer, Minority Health Staff, and also the Emergency Medicine Specific Diversity Committee. And so this is a funded trip where we go and we have tables at the fairs, we interact socially with the medical students over at these schools, basically just to create awareness of our residency programs that were out there, that we encourage them to apply, we answer any questions they have. And we create like a social atmosphere. There's like food and drinks and stuff like that involved. Our last trip to Meharry before the pandemic was so well received that they actually invited only the Emergency Medicine Diversity Committee back again to have sort of a Q&A and a sort of a mentoring opportunity there, which was great. In addition, just kind of a plug for recruitment, it's also a great platform for us, the underrepresented residents in the program, to bond, because we go away for a couple of days, fully funded, stay in a hotel and just get to know one another and support each other emotionally and mentally.
That's such an important, especially like, you know, with that retention aspects, like that is a bonding experience for residents as well. Arthur, I know you guys do some innovative things at University of Chicago. Want to share what you guys?
Sure, yeah. So I know one of the big things for us at U of Chicago is showing up to sort of these national meetings, whether it's SNMA or LMSA. So our GME office here usually has a big presence at those conferences every year. And I know as a student looking for potential emergency medicine programs, seeing them at the conference and being able to talk to residents or program directors so they can get to know me, I think that was really, really helpful. And I saw how intentional it was. And then just to see the diversity of the residents at the program just, you know, made me feel more comfortable to apply to those programs as well.
Thanks so much, Arthur. Jeff, you're up next.
Yeah, so I think it's also important to make sure that aspects of residency applications are as objective as possible as well. One thing we have at our institution is around reducing biasing language in ESLOs. Like all EM programs for all of our medical students, both home and away, who do formal rotations here, an ESLO is written for them by the program. So in order to really ensure that the letter being sent is an accurate evaluation of the medical student, there is actually a separate reviewer for all medical student ESLOs to ensure that there is no biasing language. So for example, ensuring that an ESLO isn't all about clinical skills for a male student. The goal of this is to really create an ESLO that is non-biased and as objective as possible.
Thanks, Jeff, for sharing that. And kind of speaking of ESLOs, I think this is a perfect transition to the next part of the discussion of, you know, what institutions do during the actual interview season. So Jessica, why don't you get us started?
Yeah, so in 2019, many of you may be aware of what many of us consider a landmark paper by the group at Highland. And this described the initiatives that they implemented to increase diversity. Many of our institutions that we represent here have carried out similar initiatives, which definitely involve a multifaceted approach, which we're all going to share. So the first thing is the involvement of a holistic review process with less emphasis on board scores, which don't historically correlate with success as a resident, and less emphasis on recommendation letters, just as Jeff had discussed, which are known to be inherently biased against women and people of color. Going back to what I was saying before about having a diversity committee, it's really important too that leaders and representatives of that committee have a say during the process of ranking applicants. Because after all, you can put a lot of effort into recruitment, but if you're not ranking URM candidates to match, you're really not setting yourself up for success. So having those leaders working with the program director has been extremely helpful for us. Many of us also have targeted events during interview season for URM candidates, and this really creates a safe space for them to discuss, what programs that they're looking at and like which programs they really feel welcome and safe to go to for residency. I do want to point out that one of the take-home points of that Highland study was that with increased diversity, academic excellence was upheld. I feel like this is a really common worry for programs who still use board score cutoffs and elevate things like AOA and other accolades that we do know are biased. So all of the things that I talked about require a huge culture shift surrounding recruitment practices. One of the hardest oftentimes being one thing that Jeremy is about to talk about, which is also the implementation of standardized interview questions. So he'll go over what this actually looks like.
Perfect. Thank you for that, Jess. So one of the things that some programs do is consider these standardized interview questions, and basically what they are is sort of what they sound like. So specific questions that each applicant will get to basically reduce the bias, both as Jeff and Jess have mentioned. Not all programs do this, and there are pros and cons to each way. So the traditional way of just having a conversation or other specific questions, many programs will do a hybrid of the two, have very specific things that they want to get at, and have multiple questions that the interviewer, whichever topic they're getting at, can use so that it flows a little bit more with conversation. Here at Denver, we've tried both styles. And after receiving review through surveys after interview season, it seemed like some applicants did not particularly like the standardized way. So we've gone to more of that hybrid model. I don't think there's a right or wrong answer. I think every program uses something slightly different, but the idea is to get the answers that we're looking for, to understand our applicants a little bit better, but at the same time, try to reduce the bias as much as possible.
Thanks so much, Jeremy. So it does sound like, there are variations within different programs, and really there's no right answer. So I'd be, curious to hear from you, Ryan, what are kind of the different things that you guys do during your interview day?
Yeah, specifically to what Jeremy's talking about, we actually do like a little bit of a hybrid approach because we agree that there's not a perfect balance to it. So we fall somewhere in the middle. But it brings up a great point that there's a lot that goes into interview day. And I think it's important just to remember that prospective residents are also interviewing you. But relax, you'll do great, because there's a few things, that you should do to be prepared. So first, like Jess mentioned, consider having an interview day that's specifically designed for URM applicants. Creating a day like this not only shows your commitment to diversity, but also allows other applicants a better chance to meet diverse peers and faculty with shared values and interests. I'll add that there's an added benefit that this has the ability to reduce the minority tax ask of the URM faculty, because being asked to reach out to URM applicants after every interview day is an extra task that's rarely compensated. And regardless of how you structure your interview day, keep in mind that micro affirmations can go a long way. So ask your applicants in advance their preferred name and their personal pronouns, and then on interview day, use them and pronounce them correctly. Seek to understand each candidate for who they are, because tokenism and the related concept of stereotype threat really risk alienating applicants, as they may feel an undue burden that their expected contribution while in residency is going to be that primarily of the DEI role. Kevin, I think you're up now to talk a little bit more about the opportunities of mentorship.
Yes, Ryan, I've never heard the term micro affirmations, and I like it. I think it really speaks to like the small ways that you create community. And when you're interviewing applicants, not only are you trying to understand them and their fit with your program, but you're trying to make connections and make people feel welcome. And whether that person matches at your institution or somewhere else, This is about creating openness and welcomeness and belonging in our community of medicine. And so one of the things we do with our applicants is we align them with residents that share affinities, interests, identities, and make personal connections in order to create community with them. And if Christ Hospital is the right place for them, awesome. But otherwise, you're still creating your community within medicine, and that individual connection goes a long way, professionally and personally.
Yes, I think. Oh, sorry.
No, not at all. I was going to actually, ask Jeff, what Stanford has done this year has certainly been challenging for everybody, given COVID-19. Everything has moved virtual, and a huge part of the interview season that has definitely been affected is definitely interview day and residents' ability to visit each prospective residency. So, I was curious, Jeff, what you guys do at Stanford this year.
Yeah, I was just going to say, speaking of community, I think that was a huge and maybe the biggest challenge this year with COVID. Recruitment efforts were done virtually, so applicants really had no way to evaluate programs in person. The travel and social distancing restrictions required due to the pandemic really completely changed how resident recruitment was done this year. Prior to the pandemic, as kind of everyone was pointing out, entire days were devoted to diversity and inclusion through meetings and socials with faculty and residents on campus. So when COVID made that no longer possible, a lot of these recruitment events were primarily transitioned to Zoom. And I think, at least to me, this posed a big challenge and unique challenge, was gauging that intangible sense of belonging or community that is so important to URM and to all applicants. I think there was also maybe a silver lining, though. I think the main positive outcome was residencies and applicants could extend their reach due to the reduced cost of interviewing and more flexibility with decreased travel time. So as diversity socials and events were moved to Zoom, where more people could attend and the reach could be further. Social media was also a great way to engage students and applicants. And at our institution, we even had an adopt an applicant program, similar to what Kevin was saying, to provide students with more contact points. And all of that to say, I think perhaps moving forward to extend the reach of a lot of these amazing diversity recruitment initiatives, perhaps some could continue on Zoom, but also important to include in-person formats to continue to foster that sense of community and belonging.
Thanks for sharing all of that. I was curious, what other folks at different residency did during COVID-19.
Yeah, I think similar to Jeff, we also had various Zoom meetings. So we had a dedicated DEI night, or we also had different affinity groups nights. So I think that helped with our recruitment efforts this year as well. And then again, if there was a virtual SNMA or any conference like that, we were, a part of that too. And having residents present, I think, was really, really helpful in addition to the leadership.
Thanks, Arthur. Anyone else that would like to chime in before we move to kind of, the post-interview time? All right, perfect. So, go for it.
Something that Kevin brought up that I think is really important to think about is connecting residents to the applicants. Something we do here that I think other programs also do as well is we basically send an email out to everyone saying, if you want to speak with somebody in a D&I committee, just let us know. And then usually one of us will reach out to them and say, hey, is there something in particular that you're interested in? And then try to connect them from there. Just because we never know what people are interested in, how they identify, and what's most important to them, and trying to connect them with somebody that can answer the questions that they might have. So if they're LGBTQIA+ and they want to speak to somebody about that, then we'll match them with somebody that does those things, or has some work in that area, or identifies themselves. Or if they're specifically interested in community engagement, we match them up with somebody that's interested in community engagement. So getting that more personal touch, I think, is really important, so the applicants know you do care about these things, and you have other people that are interesting or are interested or identify or are working along those lines.
Yeah, I think one of the challenging things about COVID was previously we used to think about the online resources, so like the website or some sort of social media, as like an added benefit, or or an added kind of sell to the program. And it became the core sell and almost the only way to sell the program. And so what we found was really important was making sure, one, that everything was updated and, looked good, just across the board, but then also making sure that there's advocates within like a DEI committee to make sure that each one of those is integrated, DEI is integrated in each one of those elements, be it Twitter or Instagram or just the general hospital website.
I just want to quickly mention one other thing that we did this year. One of our first year residents updated like our entire website, and there was a whole section on like DEI. And so it had like, it broke down like how many of your residents identify with these various groups. And so I think that was really helpful for people as well, to have that information, readily available on the web.
Arthur, I actually saw what you're describing, and it was really awesome. The infographics were really spot on. Final addition I'm thinking about here that comes to mind is something we did was list residents who were open to being contacted by applicants, and just a descriptor of how they identify their interests, their kind of like high level things that make them them, and allowing people an opportunity to sort through and say, this is someone that I think I would like to connect with, and then having that opportunity to connect.
Wow, it's so incredible to, oh, go ahead, Mary.
Sorry, thanks. I really like the idea of like an interview day that could help highlight it. And I think from that faculty perspective of considering some of the burden we ask of faculty to kind of constantly be present, I think that's great. I think from a student kind of advising perspective, the thing I worry a little bit about, and this is just a little bit of like devil's advocate and talking it through, but are they then going to be, oh, now I've got my schedule is even more complex. So we're taking an underrepresented student who now has to try and like find these particular days. Otherwise, I'm not going to know. And I don't know what the solution on that is. I just don't know if that, what kind, did anyone do that this year? Ryan, did you guys do that at your program this year? And was that like a burden as well? Or did people struggle with that?
Yeah, we actually haven't, and we do struggle with it a little bit, but it's something that we've definitely actively talked about doing.
I know at our program at Denver Health, we talked about it back and forth, and it's a hard balance because what you don't want to do is tokenize people, because it really just depends on how you want to approach it. And I don't think there's a right answer. I think it's really helpful when people realize that you're saying this day aside because you're showing that it's so important to you. But then at the same token, people might think that you're doing this sort of as a dog and pony show. So it's a really, really hard discussion to have to find a right answer. And honestly, I don't think there is a right answer. And we literally talk about this every year and go back and forth about.
Oh, you're on the wrong day. Like, no, they're all the right days, right? Like you belong here every day, and this is what we need every day. And I think we all sort of have to be like, but I also like the idea from the faculty perspective, and even just from the student perspective. I mean, we know that's something that we've struggled with at UT Southwestern, is sort of having, especially this year, I think virtually showing some of our like collegiality that we just, I don't think comes across as well from our like website.
Yeah, that's really hard. I think there's a little bit of a balance to things. I think the two things that I think about, one is about just really being intentional though. And so the more that you show your intentionality, I think that's really positively reflected in your program. And then the second thing is really providing the option. So it's not this, and really being clear and forthcoming that this is an optional activity, and like this comes with additional potential benefits that you may be interested in, but it's not going to negatively impact you if you have a conflict or you can't make it or you don't want to go. There's no penalty for it. So I think that having that option is really important to put up front.
Yeah, so it definitely sounds like, there's a wide range and might not necessarily be, a right answer to a lot of the questions that are posed, which is so important why we're having this discussion. So with that, I would love to move on to the next piece of this discussion, talking about kind of the post-interview season. I know, Tereo, you had some, initiatives that you wanted to talk about.
Yeah, definitely. I wanted to talk about a sort of diversity second look day. So after the interview process, I know a lot of institutions have something similar where there's a second look event that focuses only on URM students. I remember when I was interviewing for residency, I had the opportunity to attend multiple of these. They were all structured a little bit different, but regardless of what the agenda looked like, the goal was pretty much a time to showcase diversity at your institution, at your residency, a time for the URM applicants to network, to socialize, to have discussions around URM specific topics. And I think it also gives the applicants a taste of what sort of support system is going to exist for them in the residency when they do join the residency. So I think it's a powerful tool. At Yale specifically, we have a second look that's general, organized by the GME office. So basically all URM applicants across all specialties are invited for pretty much this 2-day stay, 1-night stay, which is all expense paid, which is why we talked about the importance of a budget. And so the URM applicants come in and basically you rent out this wedding venue. There's a cocktail hour, there's an open bar, and there's a program. So there's speeches, there's performances, there's music, there's dancing. And I think the best part of it is after a certain hour, all the faculty and staff has to leave. And so it's just the residents and the applicants, and then they can really start having candid conversations, which I think are very important. We did do some surveying over the last 2 to 3 years since this has been going on, sort of asking applicants what they found was most helpful for them in making their decision about choosing our residency or not. And the second look was actually the highest scoring thing out of everything that we did pre-interview, during interview, and post-interview. So I think it's a powerful tool.
Thanks, Mario, for sharing all of that. And I think, Ryan, you had some thoughts on it as well.
Yeah, I think something like this is absolutely wonderful to do, and it's kind of it's one of those compromises too that doesn't make it so that you have to do the interview day that we were talking about earlier, but still allows you to have that dedicated intentional effort. And at Michigan, we've really done something fairly similar, but we do it what we call first look weekend, meaning that it's actually before the people have actually submitted their application. So there's not even a perception that, you know, we don't even have their board scores if we wanted to look at it, or we don't have their personal statement even if we want to look at it. And so I think that was people really liked that because it felt a little bit more like we were just getting to meet them for who they were, as opposed to who they are as like an applicant on a piece of paper. There's the opportunity that this happens while they're doing their visiting clerkship, if it falls on the right week, which is nice as far as the financial consideration, the time and travel burden that comes with that. People just absolutely love the first look weekend. So we've been doing that for about 2-3 years now. But I think either way that you structure it, it's like perfectly like going to be like a positive reflection to your program as far as being, again, intentional about creating that diverse and inclusive environment.
Can I ask you a question about what you do provide, if anything, and or like how you made that transition? Like, did you go cold turkey to like, here's a name, that's all you get, from, you know, I think people in a place where they're used to getting a nearly complete application essentially.
For the first look weekend? Yeah.
No, for the interviews, you're saying you don't share your, like any of that information with your interviewers?
Oh yeah, sorry. No, so yeah, we can talk about that. But what I was referring to was the fact that first look weekend doesn't have any of that with it. But yeah, there are a lot of different strategies that people use as far as blinding different parts of their application, be it the photograph, sometimes it'll be the name, and then a lot of, we essentially kind of devalue the board scores so that they're really almost worth nothing barring that you pass.
Thanks, Ryan. So I think now, you know, moving to one of the most important part of this discussion is actually, you know, what you do post-match and the retention and resident support that's necessary if you are, you know, very intentionally recruiting underrepresented minority medical students. So Jeremy, why don't you, you know, take it away?
Sure, thanks, Wendy. And I think the post-match part is really important because you're putting in all these efforts, you're getting a lot of people involved, you have all these stakeholders, you're getting funding, and then you get your match list. And sometimes your match list is like, awesome, this is exactly what I wanted. We've done, our numbers have changed drastically. And sometimes they don't. Sometimes they go in the opposite direction of what you intended. And I think it's really important that you're intentional, as Ryan and others have mentioned, and you're persistent. It doesn't always work out the way you want it to every year. And then you have to go back and kind of to the drawing board and see what happens. So I think thinking of this as sort of QI, I think is extraordinarily important. You can send out surveys after the match just to get some more information from the applicants to say, hey, what things did you like? What things did you not like? What worked for you? What things did you notice? Give us any feedback that you feel comfortable giving. And I think from us doing that, and I know other programs have done that well as well, we've gotten a lot of information in terms of what works. I think also diversifying your efforts. So in this QI, what other things can you potentially do? So over the years, before Zoom was really even a thing, before COVID, we actually offered Skype interviews. And that was an option. We very intentionally said, this is not going to affect where you are on our rank list. If you'd like to do a Skype interview, that's more than appropriate. And every year we get 1 to 2 applicants that would do that. And that's really thinking about, this is an expensive process. Expecting all of these people to go across the country might not be fair, and they may not be able to afford that. So being intentional about who these different applicants are and thinking about ways that you might be able to overcome issues there. Also thinking about community engagement. So not just the pipeline programs, but thinking about all the programs across the university or the hospital system in which you work. One thing that we started here was something called the Minority and Allied Residency Council, so the MARC, and basically that's spanning all of the different programs. So whether that's ENT or surgery or family medicine, and that's just a group or a community for all of these different people to come to. So you're not only getting these people together, but you're also giving people sort of a home that they may want to be a part of. So thinking outside of the box along those lines. And then community building along those things and bringing in other departments. So thinking outside of the box and then asking other programs what they're doing. Doesn't necessarily have to be emergency medicine, but maybe your IM program is doing something similar. Maybe for your second look, each separate department is doing a second look. Why not do something together? So there's lots of different things that you can think about, but thinking only inside of our silos sometimes makes things a lot more difficult and you're reinventing the wheel for no reason. But you have to be extraordinarily intentional because it's not always going to work out the way you want it, but thinking forward and being optimistic is really the way to approach it.
I think you touch on so many important points, like, being optimistic. The work is never really complete. There's always work to be done, and also the importance of, community and allyship. I know, Kevin, you wanted to speak a little bit about allyship.
Yeah, thank you, Wendy. I think, a lot of people think of the match as the end or the beginning. And I think the more we can think of it as a spectrum of experience as residents and as healthcare providers, that allows us to focus on retention. And I think like being intentional about calling it retention during residency is really important, not just for your pipeline, but for community and belonging. And allyship looks like a lot of different things. In our emergency department, we had a very informal initiative that involved placing a rainbow sticker on your ID badge. And it wasn't as much an identifier as it was signaling openness for patients, for providers, for staff. And it quickly became an initiative that everyone wanted to be a part of. Everyone. The cashiers at food service would ask me for a sticker and I would give that to them. And it was just great. Like we've had patients even reference that as like something that allowed them to feel more comfortable. And so that's when you look at the broader community of like, what is our goal here to make everyone feel welcome and included. Preferred pronouns on ID badges allow everyone to feel welcome and included. And these things just, I think it's important because being an underrepresented minority in medicine is not always visible. Sometimes it is, but sometimes people identify in different ways. And so creating that environment of openness really helps people feel welcome and included and cared for.
I love that you mentioned that it kind of took root and other, specialties and people that work at the hospital wanted to get involved. And I think that's a great segue into, talking about GME. Jess, do you want to talk about what Boston Medical Center does?
Yeah, so Kevin, thank you for bringing up community. I mean, that is really the key here. There's a lot of conversation around recruitment, but our end goal is to have URM residents thrive in our programs. And while we do want to create community amongst everyone, if we're talking about allyship, I think we all know that underrepresented residents have specific needs and specific sense of community that I think residencies and cities, honestly, need to like embrace a bit more. So I will say that at BMC, we have partnered with the like GME office, so the office that supervises all residencies, and it has a paid full-time role for a URM residence, URM resident recruitment person. So that it's a non-physician who is essentially dedicated to creating these like affinity groups, opportunities for mixers, like socializing in restaurants and bars that are really frequented by like the community and like URM residents. So that has been really big in terms of like creating our community, because you know there are so many sessions going on right now about like microaggressions and whatnot, and having that space to unload and have those people to talk to is really important. And like what Jeremy said, no need to reinvent the wheel. Part of why we're all here is because there is a very limited number of URM residents in our individual emergency medicine programs, right? So really embracing those other residents in other programs and creating that community has been really huge for us. The other thing is, I know Jeremy in Denver has done a lot of work with this in terms of unifying various institutions and community organizations. Us in Boston, we're really trying to reach out, especially as a city that is historically rooted in a lot of racist practices, had across the Hammer, BI, and BMC residents, really trying to create a little bit more of a URM community amongst all of us. So you know, all of the steps that we have talked about are like very important, but if you know it's hard to get your residents to like step up and like be endorsing your program in the spirit of avoiding tokenism, like that's an issue, and it's a larger cultural thing that needs to be addressed. So I think I'll leave it at that. And Arthur, I think you're the perfect person to discuss a little bit more about how, you know, residents and in the community can work together.
Yeah, so I think as Jeremy mentioned earlier, a lot of applicants who are underrepresented, they're looking for a program that's going to be engaged with the community, because that's really important to us. And so at least at UChicago, in terms of our D&I efforts, we have a designated PGY3. There are 2 people who are in charge of that. So they are responsible for finding speakers that to speak quarterly during our didactics lectures. They're also responsible for working with one of our attendings who does a lot of community outreach in terms of like stop the bleed training. We do ultrasound days, we do, and then like hands-only CPR training as well. So they get everybody, involved with that. And then, being involved with programs at the medical school. So at UChicago, we have a program like HPrep. So that's another way that, as residents that we can get involved with that. And then there are various other like sort of community programs where they go out and do sort of lessons about like, this is what diabetes is, and sort of break down the physiology of that. And then on the GME level, they started a program this year called the Community Champions Program. So essentially we're pairing with our urban health department here, institute at the University of Chicago, and it's 24 residents from all different specialties who are interested in being sort of champions for the community. So this year we focused a lot on COVID. And so things like we did vaccination clinics, or we've done different panels. And this position is actually like you're giving an honorarium for it. So it's actually a paid position that they're giving you for your time and your effort to engage in the community. So again, I think if you want to like, it's all about like sort of retaining these students as well, but then, from a post-mats perspective, knowing that they're going to have a sense of community, it can still do the work that they're interested in is also very important.
Thanks, Arthur. What a great way to kind of, close up our, conversation before we move on to the Q&A part of our didactic. So before we get there, there's so many like amazing topics that were brought up, and certainly hard to distill everything down to a couple of, bullet points, but I did want to, pull up and share a slide of, some of the best practices that some of our panelists came together and discussed and decided on. So first being, it's important to establish a residency diversity inclusion committee, definitely acknowledge generously and compensate fairly to offset the minority tax. Think systematically, have a support system for URM residents, support allyship. That retention part is so important. It's also important to implement a holistic review process, take a multi-pronged approach, and be patient and persistent, and don't expect immediate results, but by being intentional, you will be making that impact. And with that, I would love to open up the floor to anyone who may have any Q&A questions, and I'm sure our panelists would be so happy to answer them. And I did see from our chat earlier on, there was a question about budget, and it was, aside from deciding the budget, how did you develop a proposal to approach your program leadership to request funding to attend conferences for recruitment?
So I can take a stab at my approach. I remember coming in as an intern, and basically my approach, and I think the program has sort of changed in this way. I basically said our recruitment is basically minority recruitment or diversity recruitment. And so that's how we've approached all of our recruitment basically from that point forward. So our DE&I committee is very, very involved in our recruitment committee. And the way our DE&I committee is set up, and by that I mean diversity, equity, inclusion, there is somebody that's on the committee that goes to all of the different separate committees or that sits on them. So with all of the recruitment things that we do, that's basically our lens that we look at. When we're looking at didactics, we try to look at it through a DEI lens as well. When we're talking about wellness, we try to look at it through that lens also. So putting ourselves in each of those positions so that we're looking at them through all of those, through those eyes, I think makes a really big difference. When we go to ACEP every year, our DEI committee is a person that is running the recruitment at ACEP, so the table that we have there. We also go to SNMA every year. We try to have somebody at court as well. So all of these things together, we considered doing LMSA this year, but it was slightly different because of COVID. But all of these things, basically our DEI committee is the one that's running recruitment for our program, because the way we see it is that looking at diversity across the board, however you define it, is what we're looking for. And it's not about a certain color or a certain gender or anything else. We're trying to find different residents so that one, we can learn from each other, but two, have the most impact on our patients. And if you focus everything on your patients, I think everything kind of falls into place.
Yeah, Jeremy, I would even take a step back for those of you who are trying to start a committee in a program that maybe isn't as in tune with like the benefits of diverse teams. So if your department chair and your program director and the DIO of your institution doesn't believe that everything is better with diverse residents and like a diverse like physician workforce, that is going to hinder any proposal that you write. Like that has to be kind of like an underlying understanding. I feel like very lucky I'm in part of a very mission-driven hospital, but I understand that not everyone necessarily might have that background or that framework. So I remember when I was an intern, just when the committee was getting started, I mean, there was a conference presentation about like these are the statistics, like some people don't even understand some of those numbers and like what patient outcomes are improved with diverse physicians. Like sometimes that's not a baseline understanding. So just to take a step back, I think Jeremy, like that's spot on. But if you are struggling to even get to that point, it might just be like, we need to start from square one and have everyone kind of on the same page in terms of like why this is important.
I think that's a great point, Jess. You have to meet the program where they're at, right? And so every program is going to be at a different stage. And so I think, being realistic, and that's part of the persistence and patience that goes into this work. I think the other thing too is to think that, like, remember that the proof is in the pudding. And so When your program, promotes, a diverse set of their residents to the position of things like chief resident, that is one, a very telling sign of validation. It's also, remember, an important part of recruitment. And so, when you're thinking about who's going to be doing all this additional DEI recruitment, well, why shouldn't it just be the people who are in charge of doing recruitment be diverse? And so it just flips the narrative a little bit. But I think that's a really telling sign and a great way that you can do something this year about.
Dr. Toon, do we have another minute for one last question?
Yes, let's get that one last question I was trying to answer you.
Awesome, perfect. Do we have any other questions from our audience members today?
Yes, I have a question. So I am an M4 student going into the this coming up cycle. I have a question. So how do you bring up, I guess, sensitive topics to the interview in a way that, I guess, in a way that makes it acceptable or okay for the the PD or whoever's interviewing to answer, I guess?
I mean, I think sometimes minority status is concealable or not obvious based on how you look or how you speak or how you act. And sometimes there's intersectionality of multiple states of diversity. Being a member of the LGBTQ community, for better or worse, my identity is sometimes concealable. And when I thought about my interviews and these difficult questions, I asked myself, if I was going to be myself, and if I wasn't, how long was I planning on being that, and like to what end? Which is a really privileged place to be when you're an interviewee trying to find a program. But I would encourage anyone who is not sure how to broach these things to write about them in their application, to give their own voice to it, and that gives the program permission to consider it. And you want to be at a program that's going to celebrate everything that you have to offer. And if there are programs that have holdups about different parts of what make you unique, better learn sooner rather than later. I think every applicant, particularly underrepresented minorities, brings so much to our community. And so to share that in your application is a gift, and for programs to be able to engage you with it and to understand it and celebrate it is really what we all hope for in our purpose.
Thank you.
Thanks so much, everybody. Thank you so much to our panelists and our audience members for participating today. I think, this didactic, it just goes to show that this is an ongoing conversation that, we need to continue having. And I'm so thankful that we were able to bring so many panelists from across the country today to talk about, recruitment of underrepresented minority medical students. And I'm really excited for all the future collaborations. And, we are on Twitter. Our contact information is out there. Please engage with us and, ask us any further questions that you may have. And I hope that the conversation continues. So with that, thank you so much to everybody who came and participated.